Hello, my name is Dr. Alan Kerry and I would like to welcome you to another podcast from the South Essex GP Training website. With me I have Dr. Sunil Gupta and we're going to discuss cognitive behavioural therapy. Sunil, can you tell us a bit about cognitive behavioural therapy?
Cognitive behavioural therapy is proven to be a very effective way to understand and overcome some psychological problems. Quite often how we think, feel and behave interacts together to maintain our emotional problems. Cognitive behavioural therapy tries to understand this interaction and helps us to make changes in how we think, feel and behave.
So what type of conditions can cognitive behavioural therapy help?
Cognitive behavioural therapy, CBT, can help in depression, anxiety and panic, stress, obsessive compulsive disorder, bulimia, post-traumatic disorder, phobias, e.g. agoraphobia and social phobia, as well as it can can help in some way in bipolar disorders and psychoses.
Could you tell us something about the principles of cognitive behavioural therapy?
The principles of cognitive behavioural therapy are that the way we think affects the way we act. Our experiences shape the way we think, and our thoughts, feelings and behaviour or actions are interrelated. So in terms of thoughts, feelings and behaviour being interacted, we're in a situation that brings about thoughts result in feelings result in actions, and those actions affect our thoughts. So if we're in a situation where we're stressed, that can result in our thoughts feeling low in mood. That can result in feelings, which means that we feel gloomy and feel that I'm no good. And that can result in an action, as in we do less. And as a result of doing less, we actually have fewer good times and feel unwell in our body, and that leads in a vicious cycle to feeling low.
So what are the characteristics of the negative thoughts which can occur in someone, for instance, with depression?
The negative thoughts in depression tend to be automatic, are often biased, unreasonable and unrealistic, but they do seem reasonable and correct at the time. But the negative thoughts in depression tend to make depression worse.
So can you list some examples of these negative thoughts?
There's 11 examples of negative thoughts. 1, overgeneralization. 2, labeling. 3, personalising. 4, black and white thinking. 5, jumping to conclusions. 6, catastrophizing. 7, disqualifying the positive. 8, should statements. 9, mind reading. 10, emotional reasoning. And the 11th example of a negative thought is egocentric thinking.
Okay, so the first three, overgeneralization, labelling and personalising. Can you give me more information on that?
So first, about overgeneralization. People tend to overgeneralize when they words which can indicate that people are overgeneralizing are all, every, never, always, everything, everybody and nobody. So if, for example, if a boy who starts to believe they'll never ever have a girlfriend just because one girl doesn't agree to go out with him. But overgeneralizations are unlikely to be an accurate assessment of reality. In labelling is where you can label yourself stupid or a failure or totally hopeless on the basis of one mistake or one failure, and that can result in seeing yourself only in this way. But the thing about labelling is one failure or mistake does not make you a failure or stupid. And the third negative thought was personalising, where thinking you are solely responsible for a negative or unpleasant event. So you feel unnecessarily guilty and think that everything is related to some deficiency or inadequacy in yourself. For example, thinking people aren't enjoying themselves at this party because I'm not entertaining enough. But others may have played a part and you may have only partly contributed to an event.
Thank you. Moving on, you spoke about black and white thinking, jumping to conclusions and catastrophising. Could you tell us more?
Black and white thinking is where you have a tendency to evaluate yourself, other people and situations in extreme terms. And it's very difficult to meet the stringent demands this thinking can cause. For example, thinking either I succeed at everything or I'm a failure. And black and white thinking is unrealistic because people or situations are really totally one thing or another. In jumping to conclusions, you jump to a negative conclusion when there is insufficient or no evidence for your conclusion. This thinking can result in feeling more depressed and less likely to adopt a problem-solving attitude. An example, thinking that you are going to go bankrupt on the basis of very little evidence. But looking for the evidence for and against your conclusion shows that you have pessimistically jumped to a conclusion. In catastrophizing, this is where you blow a mistake or fault out of proportion while devaluing the positive aspects of your behaviour or of the situation. For example, thinking this is terrible, I'll never be able to show my face again, when if you think about how you would view someone else in the same situation, may help you get a more realistic assessment.
Thank you. And moving on further, the next three negative thoughts were disqualifying the positive, should statements, and mind reading. Tell us more.
In disqualifying the positives, you not only ignore positive or neutral aspects of situations and concentrate on the negative aspects, it also involves changing the positive into the negative. For example, thinking the reason my boss said I've done a good job is because actually I'm incompetent and he or she is trying to get me to improve. But again, thinking about what evidence is there for and against your thoughts can help you form a more realistic view. For should statements, that's where you have arbitrary and impossible rules both for yourself and others. And this can result in guilt and shame with oneself and frustration and anger with others. For example, I should be able to do that. But excessively high standards and expectations are not compatible with our all too human day-to-day performance. And with mind reading is where you believe you know that another person is thinking about you in some way, and you also know what thoughts they are. For example, that person is thinking I cannot do this task, but obviously we cannot read other people's minds.
Thank you. And the final two negative thoughts were emotional reasoning and egocentric thinking. Could you tell us about those?
An emotional reasoning is when we are feeling something, so it must be true, even though we know it is irrational. For example, I feel stupid after making a mistake, so I must be stupid. But again, if you look at the evidence for and against our feeling, that'll help us to get a more realistic view. In egocentric thinking, there's difficulty in believing that other people have a different view to our own. For example, I believe in certain things or hold certain standards, so others must as well. But again, other people can have different perceptions and views from us.
So when we're trying to help people cope with these 11 types of negative thoughts, we ask them to consider 5 questions. What are those questions?
The 5 questions are: what is the evidence? What alternative views are there? What is the effect of thinking the way I do? Is my thinking realistic? And what action can I take?
Can you flesh those out in a bit more detail for us?
So the first question was, what is the evidence? So what evidence do I have to support my thoughts? What evidence do I have against them? The second question is, what alternative views are there? How would someone else view this situation? How would I have viewed it before I got depressed / anxious? What evidence do I have to back these alternatives? The third question is, what is the effect of thinking the way I do? Does it help me or hinder me from getting what I want? How? What would be the effect of looking at things less negatively? The fourth question is my thinking realistic? Am I thinking in all or nothing terms? Am I condemning myself as a total person on the basis of a single event? Am I concentrating on my weaknesses and forgetting my strengths? Am I blaming myself for something which is not my fault? Am I expecting myself to be perfect? Am I using a double standard? How would I view someone else in this situation? Am I paying attention only to the bad side of things? Am I overestimating the chances of disaster? Am I taking something personally which has little or nothing to do with me? Am I exaggerating the importance of events? Am I fretting about the way things ought to be instead of accepting and dealing with them as they come? Am I assuming I can do nothing to change my situation? Am I predicting the future instead of experimenting with it? And the fifth question is, what action can I take? What can I do to change my situation? Am I overlooking solutions to problems on the assumptions they won't work? What can I do to test out the alternative views I've arrived at?
Thank you very much. Sunil and I hope that you've found this podcast helpful, and we'll listen to some of the other podcasts from the South Essex GP Training website.